Hello everyone. I will make a presentation that was conducted in a project called Clinical Care for Electrical Stimulation in Physiotherapy and Rehabilitation. Our project was funded by the Erasmus Plus European Union, and our project was led by Pamukkale University, and the other partners are Craiova University, Hatay Mustafa Kemal University, Başkent University, Süleyman Demirel University, Şule State University, and Burdur Mehmet Akif Ersoy universities. And we have associated associations of Turkish Physiotherapy Association, Order of Physiotherapists in Romania, Lithuanian Physiotherapy Association, and Estonian Association of Physiotherapy. And I will make a presentation about electrical stimulation for the reinnervated muscles in the chronic phase. And we write this chapter with Yasemin Karaaslan from Hatay Mustafa Kemal University, and I also from Hatay Mustafa Kemal University, Hatay, Turkey. Muscle reinnervation is an important clinical goal in physiotherapy and rehabilitation. Ideal reinnervation is expected to be between 1 and 3 months after the injury, and functional reinnervation may take up to 1 year, but it depends on the injury distance of the target muscle. We are waiting the reinnervation to be until 3 years, but after 3 years, we don't expect any more in reinnervation. The reinnervation time depends on the level of the lesion and its distance from the target organ. The chronic phase process occurs days or months after injury. Application of electrical stimulation methods can be beneficial for patients, including spinal cord injuries, peripheral nerve injuries, and other neuromuscular diseases and gynecological problems. Electrical stimulation is considered a safe and effective treatment option for a variety of conditions. Electrical stimulation of reinnervated muscles in chronic phase. We are using frequently electrical stimulation in reinnervated muscles in chronic phase. And we know that electrical stimulation provide axon growth and accelerate sensorimotor recovery during nerve repair. In animal and human studies, it has shown that electrical stimulation has positive effects on the nerve repair process. And we know that electrical stimulation is applied to intact axons of partially reinnervated muscles, muscle recovery, muscle weight, and electrically induced muscle tension. So we use electrical stimulation. And we know that electrical stimulation accelerates locomotor recovery and reinnervation, especially in short electrical stimulation. And we know that electrical stimulation is a versatile approach for treating peripheral nerve injuries. It addresses synaptic preservation, pain relief, nerve degeneration, neurological function improvement, muscle atrophy reduction, and sensory function recovery. Electrical stimulation is applied to target organs, reduces the atrophy of denervated skeletal muscles, and improves reinnervation and sensorial functions. The application of electrical stimulation to the denervated skeletal muscle can indeed have beneficial effects on muscular fibrosis. Especially electrical stimulation has been shown to increase insulin activation by inhibiting various hydrolysis systems involved in protein breakdown in muscular fibers. By enhancing insulin activation, electrical stimulation help maintain protein balance and counteract the harmful effects of denervation-induced muscle atrophy. In 2020, Wang et al. Conducted a study about fully biodegradable and self-electrified device for neurodegenerative medicine, and they stated that low-frequency electrical stimulation therapy transplanted nerve regeneration can be achieved and the motor function of target muscles can be increased. Regenerative electrical stimulation has been shown to have positive effects on neuroregeneration by upregulating brain-derived neurotrophic factors. And we know that brain-derived neurotrophic factors has an important effect on regeneration, and electrical stimulation increases BDNF and its receptor, promoting accurate renervation of muscles by motor neurons are provided by the electrical stimulation. Electrical stimulation can enhance the expression and release of BDNF in the injured nerve and surrounding tissues. We have many types of electrical stimulation that we are using in chronic phase of reinnervation. One of them is neuromuscular electrical stimulation. Neuromuscular electrical stimulation is used to stimulate motor neurons in innervating muscles and restore skeletal muscle mass and function. Atrophy is prevented by the contraction of the muscles with NIMES. NIMES decreases muscle wasting during periods of disuse or illness and is typically applied directly on the muscles belly. Muscle strength and endurance can be improved using NIMES with exercise and physiotherapy and rehabilitation methods. Why we use neuromuscular electrical stimulation in chronic phase of the reinnervation? Because muscles that have lost their nerve supply after an injury or illness can be activated by NIMES. By doing this, it may prevent additional muscle atrophy and promote strength and muscular growth. NIMES can also be used to reeducate muscles to perform specific movements and improve motor functions in patients with neurological conditions such as spinal cord injury, peripheral nerve injury, stroke, or MS. Despite the positive effects of electrical stimulation, using higher frequency electrical stimulation can cause problems instead of positive effects. And using higher, more than needed electrical stimulation can cause muscle fatigue, weaken nerve recovery, and can cause problems in reinnervation. Wonder Woman and the Chow stated that high frequency currents cause early muscle fatigue and that short range is a better option. So, if we use neuromuscular electrical stimulation in reinnervation, for reinnervation, we have to use short range electrical stimulation. The recommended parameters for neuromuscular electrical stimulation. Before starting NIMES, the patient's muscle strength, range of motion, and sensory function should be assessed to determine the appropriate stimulation parameters. As we say always to our students in the lessons, we have to use a spatial method to the patient. We shouldn't apply the same method or the same frequency or the same duration of electrical stimulation to all patients. We should determine the right stimulation parameters to the patients. Electrodes are placed on the muscle belly that we want to provide muscle contraction. And application of NIMES should be, the frequency should be between 20 and 50 hertz. And it should produce muscle contraction, and to improve the patient's function, it should be between 20 and 50 hertz. It should provide contraction, but it should not cause a harmful feeling on the patient. In reinnervated atrophic muscles, NIMES can be combined with other physiotherapy and rehabilitation techniques such as resistance exercises, stretching, or any other rehabilitative exercises. The literature says that neuromuscular electrical stimulation is effective and has many positive effects in reinnervation phase. Same Ajaraz Jandan conducted a study in 2019, and they stated that Both the short stimulation period and the long stimulation period of NMS can improve quadriceps femoris muscle function in the elderly. And Todd et al. Conducted a study in 2020 and for 1 hour, 50 hertz symmetrical biphasic pulses, 400 microseconds to patients postoperatively for anterior cruciate ligament injuries. In conclusion, they stated that NIMES reduced atrophy of slow twitch fibers and the strength of the muscle contraction and output of fast slow which fibers were preserved with the NIMES. And Steven Slapsley conducted a study in 2011, and they reported that increase in muscle strength and function with the application of personalized parameters based on the patient's maximum tolerance. And there are also clinical applications where NMS is not effective. So we should be careful while choosing the right patients, and we need the right patients. The right electrical stimulation methods. Another electrical stimulation method that is used to reinnervate the reinnervation transcutaneous electrical nerve stimulation. The combination of stimulation mode and system created by using a small current to activate sensory axons without triggering muscle contraction is called TENS. TENS is a safe and mostly used electrical stimulation type because it's very friendly and patients love it because it doesn't cause any pain or it doesn't cause harm. So the physiotherapists also allow transcutaneous electrical nerve stimulation. And we know that TANs provide muscle function, decrease pain, and provide muscle growth in reinnervated atrophic muscles. In cases with motor nerve damage, the sensory nerve temporarily innervates the muscle until the motor nerve heals in order to prevent muscle atrophy. So, starting from the earlier time of the injury is very important before the atrophy occurs. If we start to stimulate the muscle, it's better for healing and for reinnervation. Sensory feedback is important in completing action, and TENS can be used to neural network pathways and improve sensory feedback. TENS is also used in the treatment of pain, spasticity, and urinary incontinence. Why we use TENS for reinnervation? Sure. Reinnervated atrophic muscles with nerve loss or muscle atrophy may experience pain relief with TENS. The electrical impulses of the TENS unit can reduce the perception of pain by preventing pain signals from reaching the brain. The pain, yes, the tenses most used the purpose is to reduce the pain. And for innervated atrophic muscles, also we are using TENS. Muscle contractions caused provided by electrical impulses of the TENS can increase muscle function and strength, and also TENS can be used to increase muscle growth in the reinnervated atrophic muscles. The electrical impulses of the TENS unit can promote the formation of growth factors that can help support muscle growth and repair. And the recommended parameters, TENS is used between 1 and 150 Hz in the clinic. It's usually for pain relief between 2 and 10 Hz. It's recommended. While no visible muscle contraction occurs with low frequency TENS, it's usually targeted at sensory nerves. High frequency TENS is used for frequencies higher than 10 hertz. Mostly we recommend to patients to provide muscle if we use for pain relief. Lower frequencies are better. And for muscle contraction, higher frequencies are better. Functional electrical stimulation, another electrical stimulation type that's used for innervation and fast specific type of limits and activate muscles functionally. Fast applications include restoring upper and lower extremity functions, store normal movement patterns, and stop additional muscle wasting, making it particularly helpful in the rehabilitation of reinnervated muscles that have become atrophied. And we know that fast produce a functioning movement or task, and fast reinnervate atrophic muscles in areas where the nerve is healthy in rehabilitation methods. Why we use functional electrical stimulation? Because FAST improve muscle strength and functions in patients with neurological diseases such as spinal cord injury, stroke, or MS. And FAST provide retrain muscles to perform certain movements and improve motor functions in patients with muscle atrophy due to disused denervation or other diseases. If the electrical stimulation device is worn for a long time, it can cause muscle fatigue and reduce sensitivity. Functional electrical stimulation, the waveform used is a triangular wave and the intensity is said to be in the range of 20 and 30 milliampere. The frequency of the stimulation ranges from 50 to 100 Hz and the pulse duration is 10 milliseconds. The first device is typically programmed to deliver an electrical impulse pattern that mimics the muscle's natural motor activation pattern, allowing the patient to perform functional movements such as walking, cycling, or grasping. Capedia et al. Conducted a study and they stated that functional electrical stimulation applied for 39 hours for 13 and 16 weeks in individuals with chronic incomplete tetraplegia resulted in great improvements in voluntary hand function. So we know that functional electrical stimulation is effective in reinnervation. Another electrical stimulation type is pulsed galvanic stimulation. Pulsed galvanic stimulation is used in the form of direct current modalities, and we should use pulsed galvanic stimulation according to patient's tolerance. It should provide muscle contraction, but it shouldn't cause damaging in the tissue. It can be applied directly to stimulate muscles, reduce edema, create ionic change in tissue, and administer drugs to the skin following nerve injury. Electrical stimulation of the muscle is performed either by direct current or alternating current or a combination of both. The reason why alternating current is preferred over direct current is more patient comfort. And in abstract, why we use the pulse galvanic stimulation? We use to provide strengthening in atrophied muscle, facilitating muscle reduction, re-education, protection, joint movement, and reducing joint limitation, providing orthotic support to the joint, reducing joint effusion and interstitial edema. And the recommended parameters, the innervated muscles has no motor point. The active electrode is either placed at the point of best motor response or in the form of two electrodes at either end of the muscle to allow current to flow. HVPGS is an arbitrarily adjustable frequency current with a two-peak monophasic waveform, a constant duration up to 200 microseconds, and a voltage higher than 100 volts. Mostly, the pulses of these currents are preferred to be between 100 and 200 microseconds. HVPGS is used in disuse-induced atrophy and muscle strengthening, and it provides less tissue resistance by high voltage and By that, it's more effective and tolerable according to other electrical stimulation. The effectiveness of electrical stimulation in preserving the muscle's properties during the reinnervation process is still debated and no consensus has been reached. So we know that many studies are needed in electrical stimulation of reinnervation muscles, and we need a consensus about this. And in the literature about electrical stimulation for innervated muscles in the chronic phase, we have many studies, but it's not enough still. We know Marcus et al. Discussed the use of electrical stimulation to assist muscle reinnervation and nerve regeneration in tibial anterior muscle, and they conducted they reported that the use of chronic muscle electrostimulation with modulated biphasic currents have been shown to have several beneficial effects on the denervated muscles, and they concluded that electrical stimulation can help prevent muscle atrophy, preserve muscle strength and endurance, and preserve the biochemical and histochemical properties of muscles. According to their findings, the use of modulated electrical stimulation at high frequency and pulse duration as opposed to an unmodulated current was found to improve sensory reinnervation during the muscle reinnervation. The authors also found that biphasic modulated stimulation is recommended for better reinnervation and that muscle electrical stimulation following the nervation and reinnervation tends to restore size, function, and histochemical properties better than unstimulated muscle. To the best of our knowledge, the amount of stimulation, the interval between stimulation, appropriate frequency, electrical stimulation characteristics, session duration, and type of stimulation are not standardized, and we need standardization. And in conclusion, in the chronic phase of electrical stimulation of brain-narrated muscles, agents such NIMES, TENS, and FAS are effective techniques that can be used in physiotherapy and rehabilitation to restore muscle function, stop additional muscle wasting, manage pain, increase muscle endurance, and improve physical therapy results. Although there are many studies on electrical stimulation, we need still more and more studies to have a standardized results for reinnervation. And so I think this project is very important for the literature because many studies are needed, and still we have no standardized methods. These are references and our project partners. Thanks for listening. Thank you.